Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left 8 and its association with the inferior alveolar nerve. On the panoramic view, we can see that the inferior alveolar nerve is in close approximation. But on the transaxial view, which is basically the proximal view, so this is the wisdom tooth. This is the inferior alveolar nerve. As we are moving distally, we can see that the inferior alveolar nerve is not in contact and is relatively far away from the um, wisdom tooth. We can see that this is a grossly carious wisdom tooth which is placed very lingually. The inferior alveolar nerve is buccally but very inferiorly. The cortical plate on the buccal hand side is quite thick, so hence a lot of guttering can be done and will be needed in order for this tooth to be taken out. The tooth, however, the interesting thing about this wisdom tooth is that it doesn't just it's not just present in the ramus, it's also looped around bone, and there is a very huge curvature here as well. So extracting this wisdom tooth, these are the points that the surgeon needs to keep in mind, that it is looping around bone. Both the roots are fused with the bone in the center, and there is a huge distal curvature which of the root at the apex is a slight dial isolation. Here you can see that it is also very curved at this point as well. The crown structure is grossly carious, and there is a risk for the tooth to break as well. Here we can see this is the grossly carious tooth. This is where it is present. It's got a very thick cortical plate. Even the cancellous bone in this region is not very radiolucent. And here we can see this is where the two roots fuse, and this is that curvature that you can see that distally curves right here. This is that curvature that we're talking about.